Hello guys. I saw a lot of discussion among students about this particular question which was asked in the recent INICET exam. It was the case history type of question and the answer was to choose between PhacoLytic versus PhacoMorphic glaucoma. So I thought I will just share a small concept with you which will help you to arrive at the correct answer. So why was this question asked? Lens-induced glaucomas are a very common clinical condition which we see in our clinics either in the OPD or in the emergencies. In fact, if any of you join MS or DNB Opthal, I can tell you for sure that you will see at least 8 to 10 of these cases during your 3 years of residency. Who are the people who are affected by this condition? These are usually elderly people, those who have neglected their cataracts for a long time, or those who have got one eye cataract surgery done and have ignored the cataract in the other eye and left it to a stage wherein it will undergo complication, either phacolytic or phacomorphic. So what does phaco mean in ophthalmology? Phaco means lens. So phacoemulsification means emulsifying the cataractous lens. Phacodonesis means the lens is shaking. Phacolytic means the lens is disintegrating. And phacomorphic means the lens has become very fat or mota. So let us look at the concept now. Don't try to read anything on the screen over here. It is a very busy table which I have given from my book Sure Success Magic. I have described all the conditions, all the types of lens-induced glaucomas over here. The two common types which you have to know are PhacoLytic and PhacoMorphic. See, when does a PhacoLytic glaucoma occur? It occurs in a hypermature cataract usually, and here the anterior chamber is very deep. It is also called as lens protein glaucoma. From the lens capsule, the lens proteins leak out. These are engulfed by the macrophages, and these go and block the trabecular meshwork. So, in phacolytic glaucoma, the anterior chamber is very deep. Because the lens proteins have leaked out, you see a lot of flare or refractile matter in the anterior chamber. Like you see in the top image over here, the anterior chamber is appearing almost white because the lens proteins have got collected over there, liquefied lens matter you could say. Whereas what happens in phacomorphic glaucoma, morphic the term itself says the lens has become very thick. It is an intumescent lens, intumescent cataractous lens which has gone and caused an angle closure. The two lines you see in the bottom figure here are between the iris, the orange line, and the cornea, the white line. The anterior chamber is very shallow over here. So one point to note that in the phacolytic glaucoma, the anterior chamber is very deep. You will find a lot of flare. In the phacomorphic glaucoma, you will find that the anterior chamber is very shallow. Both of these conditions present similarly. They have a history of decreased vision for quite some time, and there will be acute pain, redness, vomiting due to raised IOP. IOP will be very high, and of course watering, photophobia and all these things. And what is the treatment for this condition? The first thing is to reduce the IOP by giving either hyperosmotic agents like mannitol, diamox along with anti-glaucoma drugs. And what is the definitive treatment for this condition? The definitive treatment is to remove the cataract by doing a cataract surgery. Also note that because these are complicated cases, the chances of complications occurring during cataract surgery are more. So hope that helped you guys. All the best, study well.